With an aging population comes many challenges that need to be faced, but will the country be prepared to implement the necessary policies?
We shall also be challenged by the changes in our demographic profile, where Malaysia is becoming an aging state by 2030.
An aging population is defined as the worldwide phenomenon where people aged 65 above is increasing due to the increasing mortality rates, declining fertility rates, and rising life expectancy. Malaysia is expected to become an aging nation in 2030, where the elderly population overreached 50% of the total population. The elderly population is increasing, meanwhile, young people decrease year by year. People aged 65 and above increased from 7% to 7.4% in only one period. Malaysia population growth rate is declined to 0.2% as the number of non-citizens dropped to 2.7 million in 2021. This was in line with the movement control order, which causes foreigners to return to their own countries and national borders were closed to stop the COVID-19 pandemic from spreading. There are four highlighted issues in the aging population. First is shortage in labour supply. The fall of population growth and working age population of Malaysia will contribute to a decline in GDP as the size, competitiveness and productivity of the workforce is lessened. Also, low unemployment rates cause the organisation to face limited workers as there are no available employers to hire. If the problems stay in the long run, the country become less competitive as the business lack the human resources talent to develop. Second, a decrease in the saving rate. The saving rate for the aging population is low as people withdraw their saving as their income decline in the retirement. In macroeconomic, in the long run, if the saving rate fall, the rate of the economic growth will fall as well because there will be fewer funds available for the investment. In Malaysia, retirement age is 60 years old, but the amount of almost half of the Employees Provident Fund (EPF) members have less than 10,000 in their account. When people reach their retirement age, they do not save enough money to retire and cope with living needs. Third, healthcare costs increase. As people age, the vulnerability to disease is higher. The issue of lack of strength, unhealthy diet, overwork might contribute to getting chronic disease or mental health problem. The increasing healthcare costs such as regular checkup, medicine, causes the elderly to use their saving money to pay for their expenses. Lastly, aging population, gender and ethnicity. In Malaysia, female dominate the older population with 1.2 million and male follow closely at only 1.1 million in 2020. It was in line with the research that women have lower mortality rates throughout their life due to the differences in lifestyle, biological and environmental factor. In terms of older age in ethnicity, Malay stated 7.42% and followed by Chinese and Indian 1.08% and 0.2% respectively. Poverty is a major threat to the older population where they are becoming old. Health issue and retirement makes them incapable to escape from becoming or remaining poor. Older women are at risk of poverty because they have lower labour force participation as only 17.9% of the female is employed.
Many policies have been put in place to address the issue of aging population, one of which is encouraging older workers to stay in the labour force for extended periods of time. In December 2020, the Malaysian government decided to increase the retirement age from 55 to 60 years old. This policy was implemented after many stakeholders discovered that it is one of the solutions to the problem of an aging population. Furthermore, as announced in the Budget 2021, the social worker, which is simply known as Jabatan Kebajikan Masyarakat, has increased the old pension from RM350 to RM500 effectively in 2021. This pension is for the senior citizens aged 60 and above with household incomes below the poverty line average who do not live in welfare homes or care facilities will be eligible for financial assistance. These policies will lead to an increase in tax revenue and consumer spending. Why? Because as the retirement age rises, older workers who are still working must continue to pay taxes to the government, which indirectly leads to increased spending because they are still earning money. Furthermore, these policies are being implemented to address the issue of those who retire early because they pay lower income taxes. The concern of elderly care is being addressed gradually. As a result, several institutions have started to recognize senior employees through human resource management. Shifting older workers to less tedious jobs provide reassurance to the older employees. who may be slower in terms of energy-saving work. This policy doesn't indicate putting them in positions that are less important. Instead, the company can place them in roles that will benefit not only them, but the entire organization. Human resource manager, for example, can increase as well as the organization's good name through enhancing the quality, price and accessibility of childcare, implementing laws and addressing gender norms and attitudes. It has been raised that older employees who continue to work due to the extension of the retirement age may face discrimination from employees or colleagues due to perception. Therefore, human resource management play a vital role in ensuring that age-based discrimination regulations are in place.
From 60 to 65 years old to utilize their experience, 63 and 68 respectively. Older employees that voluntarily to re-employ will receive additional wage up to 3% more in their paycheck, as known as the Special Employment Credit. In Canada, full retirement age is 65 years old, but employees can receive retirement benefits starting 60 years old in Canada Pension Plan. Lastly is the comparison on the healthcare support system. Japan implemented the Good Plan that aimed to promote health and welfare of elderly and also aimed to improve their infrastructure in home and in care facilities. Next, Singapore implemented national insurance, so there is no charge at all to the individual in all acute care services and physician-provided primary care services. To conclude, Islam already teach Muslims to follow the guideline in Quran and Sunnah in taking care of aging population, where they highlighted Muslims to create legacy, as people should get married if they afford to, and their children will contribute back to the economy in terms of providing working age people. Also, they mentioned the importance of social care as helping one another and respecting elderly, as they also human beings that once before being young and contribute a lot to the economy. Hence, it's our turn to provide them with support as return to what they did before. In fact, Muslim countries that follow the Islamic teaching have a young and powerful working force that lead to the massive economical growth. All in all, Islam already direct all society to care for elderly, and it's our obligation of Muslim society to follow them by taking care of their needs, health and well-being.